This illustrates an age-old medical adage that this virus has been seeing us a lot more than we've been seeing it. And the problem here is that it goes back to the data. You know, if we're using data that has such a big error rate, and we're using that data to help guide social behavior, and in my case, medical behavior, and it has such an enormous error, then we're not going to be able to appropriately take care of the people that we're supposed to be taking care of. And so when we need much better analysis of the data. So what we've done, in addition to daily input from our major medical systems to see what impact this virus is having on our community to help guide our medical behavior, we've also reached out to data analytics people. We've been working with a group of people that's an offshoot of Caltech, Virtualitics, that uses artificial intelligence built in to the calculations so it self-corrects, it machine learns, and the calculation, rather than being based on the number of deaths, is based on a continuing analysis of the statistics. So it corrects itself as you go, and so it continuously gets better and better and better. And what we see is that using these types of calculations, the error rate in the typical calculations that are being used, for instance, from the University of Washington, that are being used to model behavior and to guide behavior, is 5 to 6 times has a 5 to 6 times higher error rate than the current calculations that we're using. And so I think that the more we learn about this, the more we learn how to analyze the data, the better we're going to be able to guide social behavior.